There are just a couple tests left when we talk about lumbar instability. And so again, we're thinking along the lines of fractures. And so we're thinking about spondies and instability. So things are moving in a way that they're really not supposed to. And they're going to be complaining of variations of pain and difficulty sometimes catching. All kinds of stuff can go on when we're doing this. The first test, which is very, I would like to say simple for the patient, but can be a little bit harder for the clinician. I would recommend having a lower table than this. I was just too lazy to lower the table to do this test. But if you're on an up-down table or something, it would be great to do it this way. And so all you're gonna do for the passive lumbar extension test is, if they're complaining of low back pain, what you're going to do is you are going to just elevate their feet about 30 centimeters up off the table. So they're just laying down, they're really nice and relaxed, and what you're gonna do is take their feet together and pick them up off the table, and by putting them into extension, that would cause pain in their lower back. And if that's the case, then that's a positive test. You're not looking really for radiating pain or anything else down into the legs, like when we're looking for neuropathy stuff. We're actually looking for legit pain right where the fractures or unstable segments are. Okay, then the next test that we're gonna do, and by the way, that test has really high sensitivity and specificity, so it's an excellent test for lumbar instabilities. The next test is going to be the prone instability test, where your patient is gonna come and they're gonna lie all the way at the very end of the table with their hips hanging off. So basically just bent over the table. Yep. And what you're going to do, they need to be relaxed with their feet on the ground for this. And again, you're going to palpate their spinous processes and their transverse processes. And I typically start with the transverse processes, the lumbar, because they tend not to be as tender. Spinous processes are often very tender when you palpate them. And so again, you're gonna find your sacrum and your PSIS, and then come just inside that and palpate and see if you can elicit any kind of pain or notice instability as you do your PA mobs of those. And you can also do rotational stuff, just like when we talked about the pavums or pavums earlier, to see if there's anything going on. If you can do all of this and you're not noting a hyper or hypomobile segment, then the test is done. But if you push in an area and you sense that there is a hypermobile segment, and especially if they report pain, so if we're talking about spondies, right? Spondylolisthesis, spondylostheses, especially spondylostheses, what you would do is you would keep the pressure on the painful area and then ask the patient to actively pick up their feet. And by doing so, they're going to, there you go, they're going to actively use their lower back, and this should alleviate their symptoms. You can put your feet back down. The alleviation of symptoms means that this is a positive test for instability, because the muscles are starting to contract around that vertebral segment and they're making it more stable again. So really looking at doing strength and conditioning of those erector spinning and some of the supporting muscles would be really, really important for these patients. Also, if they haven't seen a doctor yet, they probably need to get some imaging.